Okay, I see our numbers slowing down. So again, welcome everyone to the Rural Health Transformation Impact Series. This is our third Impact Series. This one is on Healthy Beginnings, which is an initiative within the Alaska RHTP application. Next slide. So for those of you that attended the first two, again, you're going to see very similar slides, but the focus for this impact series is healthy beginnings. So our facilitators today is we'll go to the next slide. Dr. Ann Zink, who's an emergency medicine physician. She's also a consultant and a professor with the Yale School of Public Health. And Dr. Lisa Rabinowitz, she's a practicing emergency medicine physician and also a consultant. They are going to be the facilitators today for our Healthy Beginnings Impact Series. Again, they will be facilitating and going over the RHTP program, deep dive into the initiative, and then engaging in a conversation with all of you. So we really look forward to your participation, which will be in the chat function. And also we will be unmuting you so that you can share your responses to the questions. With that, I will pass it over to Dr. Rabinowitz.
Perfect. And thanks to the entire Department of Health team and Commissioner Hedberg. We really want to dive into healthy beginnings today, and we're excited to come together to find ways to really innovate and partner as we envision real impacts to the rural health system, especially for maternal and childcare. Thanks to all of you for making time to come together. Some of you have already made it to one of the other impact sessions. So this is our third one, as Commissioner Hedberg mentioned. And so there'll be some overlap, but we're excited to get everyone collaborating. Really encourage everyone to put their information into the chat box. Introduce yourself, share details about yourself, your organization, kind of what your organization hopes to advance with rural health funding. And again, reminding people not to be shy because we really want collaborations to happen both in the webinar and outside the webinar. So put your contact, your email if you're comfortable with that. Let's create this community of practice around maternal and infant pediatric care today. And next slide. So Department of Health has worked really hard to create robust resources, and they've kept the process really transparent. And we want to encourage you to go to the website, which is just a wealth of information. I frequently go back to it for information myself, and they're constantly adding new information to the website. There's also office hours really for technical assistance around the application process itself. And then we're going to be hosting some in-person regional meetings so we can kind of get on the ground community input on the unique needs. And those dates should be coming shortly. And today, as we mentioned, we're in an impact session. We're working on healthy beginnings today. And really, the impact sessions are organized around 6 focus areas. And these were identified after feedback from many of you and communities as we decided how to best transform our healthcare delivery systems. And next slide. So what these are is really taking monthly sessions that we are organized around these 6 topics so we can do a deeper dive. These first sessions are kind of overviews, what we want to accomplish with it, but we're hoping to really get in the weeds at some point in each of these sessions. So for Healthy Beginnings, as subsequent sessions happen, we want to have breakout sessions. We want to dive in on certain topics. It's important to note that your organization may cross over with multiple of these initiatives. And so we definitely encourage you to come to as many that align with your vision for your project as you can. And there's a lot of things that we're going to accomplish. We're going to exchange ideas, lessons learned, really focus on ideas that work and don't work because we can learn a lot from projects that need to be kind of revised and recalibrated. We also welcome a lot of feedback because this really needs to be useful time for all of you. Um, so a quick reminder of what these sessions are not. They're really not meant to be a forum for technical assistance or project approval or endorsement. And Dr. Zink and myself have no stake or role in selecting these projects at all. So next slide. It definitely is about connecting, and that's the whole goal for these impact sessions. And that includes stakeholders across the state, in addition to tech experts, vendors that maybe can add expertise to your project. We also want to foster collaborative learning and information exchange, building a shared vision for transformation, and using informed examples from in-state and out-of-state that can help us work towards our goals. Sparking innovation and encouraging participants to really reimagine. Again, also focusing on things that didn't work and how we can expand that or change that to be effective. And then identifying and promoting partnerships among stakeholders. And that's an important goal, as I mentioned, to this. And next slide, please. So the basics on Rural Health Transformation Program. There's a lot of great work happening in Alaska in the last few decades, but there's a lot of efforts that we can help with this Rural Health Transformation Fund. But this is really a specific set of one-time funds that Congress appropriated to improve rural health care. So that's really its focus. And Alaska submitted, this application, and it's a 5-year program, 50 billion across 50 states. And they did such a great job on their application that we ended up with one of the highest awards in the country to be allocated between January to October, and that's 272 million. Next slide. We are currently in that short timeline right now. The state has to give progress reports every year, meet certain metrics, and they really can't change the basics of the application, but it's meant to be an iterative process. So it's not that things can't change and evolve over these 5 years, and we anticipate that should happen, but really we're in the middle of this state award for year one, and we're working hard to make sure that we can make the best choices for our state. That's why you'll also see this focus on regional collaborations and why this is really focused on blue sky ideas in these impact sessions, because you may not have submitted your blue sky idea in year one, but years 2 through 4, we can start working on that to be successful for year 5. We've got a robust health system in place. And next slide. It's always good to kind of go back to the vision. And the state has prioritized and making sure we're kind of aligned with those funding goals as we move forward. So making sure it's affordable for Alaskans to stay healthy, reducing barriers, including workforce, using technology and systems to increase the availability and decrease redundancy in the system, which we haven't talked a lot about in these sessions so far. Reminding ourselves that awards need to align with the vision also helps us keep on track. And we've been asked in the chat a few times, like, how does this relate to the rest of the goals for the health system in Alaska? And that's another thing that we're working closely on, is making sure this aligns with the large plan for Alaska as we move into the next few decades. And next slide. To organize that vision, they really broke it into these 6 initiative or focus areas that we are focusing on these impact series. The first 3 are really health systems. So Healthy Beginnings, focusing on maternal childcare. That's what we'll be doing today. We've got healthcare access, which is a huge barrier across the state. And then healthy communities. How do we build that foundation? And all of these in goal 1 are really building that health system that can support the entire framework. Goal 2 is pay for value. How do we make this fiscally sustainable? And there'll be a session on that next week. Strengthening workforce, we talked about earlier today, and tech and innovation. And those are really areas that we can help build in this framework so we can keep it functional and available for everyone throughout Alaska is really the goal. So again, today we're going to focus on healthy beginnings, and we can go to the next slide. Here's where we kind of change direction and try to have some fun. And as Commissioner Hedberg said, we really want it to be interactive and finding ways to inspire and help each other as we reach towards innovation, and hearing an idea that somebody has, thinking how mine connects with that somehow, but we could even take it 1 or 2 steps further, and that would be an even better reach for our idea. So I think that's where we want to set the bar for these conversations. And next slide. So why focus on healthy beginnings? That kind of seems like a silly thing to say. We all know that maternal and pediatric childcare is important, but really this initiative aims to strengthen the foundation for healthy families. And healthy families are why we're working on this at all. We need to transform health in our communities across Alaska, and especially in our rural communities. So there are some approaches or contexts that the state has put down. So we can kind of use this as a guide as we talk about where we can go with our innovation, and our funding needs to align with that. So obviously our unique geography creates challenges. Regional and local hospitals providing critical labor and delivery services, NICU, maternal health, and pediatric care across vast distances. Families living off the road system facing provider shortages, long travel distances, unreliable transportation, which we've all experienced. We are often seeing pregnant women having to leave their communities, relocate away from their support network. How does that work? And how do we build in high-risk monitoring, and decreasing the logistical strain for families? And then after birth, mothers, infants facing isolation, limiting support. How do we build that in for lactation specialists, nutrition, pediatric needs? And then expanding access to timely technology-enabled evidence-based care, enhancing child home health visiting programs, growing programs that move through the life of the child to support them, and just building that foundation. And we can move into the next slide. So, state of the state, we know that there's a lot of great work happening. Most of you on this webinar are involved in that in some way or another. And over the last few decades, we have seen a lot of innovation already happening, especially around maternal and childcare. There are many statewide quality improvement initiatives, such as the Robust Perinatal Quality Collaborative, and expanded school participation in service programming, which especially in rural Alaska is key. But we still have a lot of challenges, and our maternal and health outcomes are below national averages. And we've seen a rise in the pregnancy-associated mortality rate, especially in rural Alaska. So as we think about this, what other key strengths, challenges should we be considering as we envision healthier beginnings in Alaska? Start thinking about what that involves. And next slide. So potential uses of funds, and this is, the state has put out some things on what they've been thinking about, what this could entail. And potential uses of fund that we can focus on today are in this list, but I want everyone to be thinking much broader than this. So we can expand technology-enabled maternal care. We can modernize maternal care facilities and staffing models, strengthening rural health and early childhood development, enhancing these home visiting programs, building healthy habits for youth, and there's many ways to do that, and the technical support to help with these projects. So this is just the basics, but I want us to really go beyond this in these discussions today. So next slide. So this is a poll, and this is where we really need all of you to stay engaged with this. These are some priorities for healthy beginnings, and we'd really like you to rank these. And if we can pop that poll up, Julie. And once this pops up, if everyone can please take some time to quickly rank this. And this is what we're going to use. There we go. This is what we're going to use to kind of direct our next sessions and what we prioritize for this group. So if we can just spend a few minutes, kind of fill this in, that would be really helpful for all of us. Okay, and Julie, when that starts to slow down, we'll close it out. Okay. Let's work on closing this out and seeing what you guys have prioritized. Voila. Okay. So really focusing on maternal, prenatal, newborn health. And I think that's across the board. Everyone has kind of found that as the main thing to focus on. I think school-based and behavioral health is important. I think vaccines and oral health, as well as ACEs prevention, are up there as well. And then, interestingly, the integrated complex care, which kind of sneaks into all of these initiatives, is also high up there. So we can close that out and we'll take this information back to inform our next sessions. And we can go to the next slide. So we're gonna go into a vignette, um, and we're gonna use this to then build off of with our conversation. So Lena is 27. She lives in a village, a coastal Yupik community in the YK Delta, accessible only by air. Pregnant with her first child, she receives prenatal care during intermittent provider visits to the local hospital. Gaps between visits make it difficult to manage her nutritional needs, monitor her baby's development, and address her anxiety around her first child. Behavioral health screening is limited and coordination across providers can be inconsistent. Her due date's approaching, and she must leave her community weeks early to kind of wait near the regional hospital in Bethel for delivery. So she's separated from her support network, and it's stressful, it's isolating, and it's a huge financial burden on the family. So next slide. So I'd like to encourage people to, in the chat box, think about these questions. What would a transformed system for Lena look like in Alaska? What does that look like for maternal and pediatric care? What would be different for Lena's family, the providers, and the communities as we transform a system like that? So really focusing on these different areas. And if we can get some people that are interested in speaking up, please raise your hand and we'll unmute you so you can chat with the group a little bit about your ideas. Again, everybody has great ideas and the projects coming in are amazing, but we really want to do some blue sky thinking with this and think bigger on these systems. So that would be great to get some feedback in here. I'm starting to see some great things in the chat already, but again, get in there. Let's try to find some ways to create some dialogue. And I only have, let's see, one person with their hand raised so far. So let's get some more conversations going. And Tamar Ben Tosif, if you are able to raise your hand, we can unmute you because I think you had some good insight to share with the group.
I think I'm unmuted.
Perfect. Perfect.
Can you guys hear me?
Yeah, we can hear you.
Okay,
Go
Okay,
ahead.
great. My name's Anjali Madeira. I am a certified nurse midwife at South Central Foundation. I work at Alaska Native Medical Center. I'm also a clinical researcher there, and we have submitted to NIH already a proposal to focus on exactly understanding the physical, emotional, social impacts of what we're calling maternal transport when folks are doing exactly what you described in the vignette, coming either to their regional hospital from their village or all the way often to A&MC to have their babies. So that is in the works, and we're trying to sort of really establish and document what are some of the challenges. We've heard anecdotally what a lot of them are, and we can sort of gather what some of them probably are. But to really be able to document them is the first step in understanding how to best support. And then the second step is to actually talk to birthing families, right? To be able to understand what are the things that are hardest for them. It might be regional specific. So our grant is going to be focusing on the North Slope to really understand for the folks that are coming from the North Slope region, what are their challenges? How is this transport affecting the family wellness? And I think focusing a lot on family wellness is going to be the key for supporting these birthing people and their families as they're coming, because when we think about the challenges for pregnant people that are coming, sometimes weeks, sometimes months ahead of time to A&MC to await delivery. Sometimes and often, really, they're coming without their partners and without their small children. And so it's impacts on the birthing person, but it's also impacts on the kiddos that are left behind and the family members that are left behind. So we're really trying to take sort of a full family wellness perspective on this. And, in terms of A&MC, thinking about how can we best support the folks that are here waiting. So we're thinking about, support groups, peer support groups, lobbying for Medicaid to increase the, options of who's eligible for escorts, because right now Medicaid really doesn't pay for family members or partners even to come and be with the birthing person during their labor. So those are the things that I would love to focus on.
Yeah, absolutely. I think there's a couple great insights from Anjali and what you've talked about. I think really informing on the community level. So talking to families, really getting in there and finding out how we can make a difference. I think the other part to this is, you're working with the NIH, and this is how we broaden our rural health initiatives into the greater scope and the plan. And so I think both of these are very useful. So thank you for sharing. And Tamar, you have your hand raised. Go ahead and share with the group, please. And Tamar's with A2P2.
I'm not sure what you're. Hi, this is Tamar. I'm not sure what comment you're referring to. You're just talking about my poll or a
Yeah,
specific.
exactly. And kind of how
Gotcha.
you guys are framing rural health transformation for maternal and childcare.
Um, so I think, the challenge for me with that poll, and I've been in situations in the past where, like legislators have asked us to rank, is that I don't feel like those are not they're not disconnected, or more so they're all those topics are interrelated and connected, and it's very hard to prioritize one over the other because they all have such a strong relationship on the other. And that's kind of how we approach our work and our mission of closing gaps in care for families and children at A2P2, is really understanding that continuum of like prenatal to 26 is our kind of age range of families that we serve from Help Me Grow Alaska, but also thinking about, families in general in Alaska. The parent's wellness has everything to do with the early beginnings of the child, and um, the systems in which they live in and the services. It's all. So I think.
Yeah.
Sorry, I wasn't expecting to
No,
respond
I
verbally
think
to the
it's
poll, but that's
I think it's
yeah.
good. I think what I wanted to highlight is really that these are all interconnected, and this ranking system isn't placing more value on one or the other. It just means that maybe we need to place a little more work on one of these sections earlier on. And it's by no means taking value out of all the other work and all the other sections. So I just wanted to highlight that when we do rank these, it's not an end all be all. It's just how we can kind of inform those conversations. So thank you for sharing. Again, encouraging people to raise your hand and speak up a bit so we can, chat about this some more. I think this is really important. Rita Short is part of the home visiting program, and I think a lot of maternal and childcare relates around home visiting. So I don't know, Rita, if you have anything you want to share and maybe be thinking about that. In the meantime, Jennifer Harlos has her hand raised. So if you could come off mute, Jennifer, and share your thoughts with us.
Yeah, hi, can you hear me?
Yeah.
Yeah, just thinking about this, again, going full circle, I'm from ANMC, like Anjali, really understanding what is driving the need for our moms to come so far in, and what are the public health things that we need to focus on, like blood pressure and diabetes management and those types of things, to be able to keep moms closer to home when they deliver. So really just getting numbers on that and being able to understand what's driving so many of our transfers, and how we can keep those moms closer to home. If there are things that we can do to strengthen the hubs so that they're better able to support more moms to deliver closer to home, I think that would be very helpful. So that's one of the things that we wanted to apply for, is like just trying to get the data and understanding how does that data look for all the different regions across the state, so that we can give that back to the regions that we have here in AMC and just say, hey, this is what's driving it. What can we do to look at this so that moms can deliver closer to home? I saw somewhere in the webinar chat, people were talking about direct entry midwives, and that's great. And like that, I would be all for that, but we also have to have moms who are healthy enough to deliver in their village. Yeah. And right now we have issues with that. There's a lot of moms who are risking out. So those would kind of be some of my thoughts there.
Yeah, no, I think that's amazing. And again, thanks for all the work that your team is doing at ANMC. I think what I'm hearing is really informed transformation. And I think that's been a huge part of what Department of Health is prioritizing to make sure that the efforts we do put in are going to have the effect that we would like. And I'd like to kick it over to Anne just for a minute to talk about data. She thinks a lot about this and the transformation in Alaska.
Yes, thank you so much. It's wonderful to see so many familiar faces on this call. Sorry, there was a little double booking earlier, but it's wonderful to be here with you all thinking about, honestly, the most important topic, like healthy beginnings and how we like do this for the next generation and really have impact for them. So I'm really excited to see the conversation happening. As previously mentioned, we will have separate topics about like technology, and we had one on workforce this morning, and always happy to go into those. But I also want to just emphasize on the data component that there is data that we can see. There's data and claims data. There's Medicaid bill data. We're working with the team at Department of Health as well as some of the subcontractors to think about what data would be helpful to look as a state as well as in each individual region to think about what is the workforce, what do outcomes look like, how can we build on other data sets that are already there, like Healthy Alaskans, to be able to say, what do we know? What do we not know? So that we can make data informed decisions. But the other thing that I always want to emphasize in data, and when I see the people of participants in this group, is that there's information, and information is often what we need to make decisions based on. And information is driven by data, but information is also driven by experience. And so we know that not all data will show up in all sorts of data sets and experiences. And so these webinars right now are helping us to gain data and information to be able to drive change and transformation and impact better together. And so to our non-Alaska colleagues who are getting to know, I was presenting just moments ago about the challenges in Alaska data and data space. Some things are seen and some things are not seen. And so the stories and the information can be just as important as the data behind it. We want to make sure we have data-driven decisions, but we need to make sure they're in context. So really excited to see what that looks like, particularly when we're thinking about healthy beginnings and the dyad of a mom and a baby who in our data sets get separated, but in life are one unit together. And so what ways can we make sure that that unit is treated as a whole unit rather than separating them out between the different? I just would also emphasize that I think as we see CMS and the rural health transformation and technology change our world, we used to have Dr. Google, and now there's Dr. ChatGPT, and there's Dr. Open Evidence and Dr. Claude, and like so many in many ways. But now with things like Fresh Start, being able to manage your blood pressure at home, how do we make sure that we're also able to see what people's health metrics look like in community if they're not getting their health within a traditional healthcare system? So I just big kudos to the Department of Health for thinking broadly about those data sets. So thinking about moms checking their blood pressure at home so we can decrease severe obstetric complications and help to support that dyad is going to be an important tool of how we have impact in this area.
Yeah, no, that's great. I think as we move forward, let's continue this conversation, especially in Healthy Beginnings, because I do think it's important. We do have a lot of information and a lot of work happening. So let's continue that informed look at all of these processes. I think I'd love to hear from Cassie Warner, who has a great comment in the chat. And really seems to have some great insight into the region that we're talking about in our vignette today. So Cassie, if you're willing to raise your hand, we'll bring you off mute. And there she is. So go ahead, Cassie.
Hi, thank you for hosting these events. This is my third one attending, so I really appreciate you guys taking the time to give us this space. In the chat, I had just mentioned increasing our availability of home visitors in more rural Alaska communities. That way, those that are expecting a new member to their family have somebody that they can rely on and get some supports between their medical visits, somebody that can help connect them to resources. In this specific scenario, I had also put in there that the home visitor can help do a warm handoff to a partner organization in the community where the family will be traveling for the birth of their child, helping kind of keep some continuity of care. And also the rapport is really important. So if there's a home visitor that a family's already been working with and they suggest somebody in a new community, that's somebody that has been partnering with the home visitor, can really help the family feel comfortable and safe in that new chapter of their life.
Great. And I love the concept of the warm handoff. I think we often get so siloed as everyone's doing great work around the state. Sometimes we can get a bit disconnected, and really connecting our tribal partners with our state partners, with our private partners is part of this effort indeed. So thank you for sharing that. I also want to call on Shane Scott. So go ahead and come off mute and go ahead and share your thoughts.
Hey there, this is Shane Scott. I was on the last session as well, but with Healthfront Ventures, and I wanted to touch on what Ann said about the about data. And we see it as data and measurement as learning systems, and the earlier that you learn and iterate over time, the information compounds. And those who hesitate and delay, they also compound, but in the opposite direction. And so it's so important to actually, take data and look at it for what it's worth, but it's really a learning system.
Absolutely.
More so than it is a, it's great. Reporting is important and all that's going to happen. but the focus needs to be on learning from the data. So it's got to give you information, data-driven, informed decisions, as Ann said. That's my comment.
Absolutely. Okay, and perfect. So I think we've had a few comments on data and getting the background as we move forward, and so I appreciate those insights for sure. And I think what I'd like to do now is have Anne flip us to the next slide, and we're going to look at our vignette from a transformed position and see where we can take this conversation. So
Perfect.
next.
So I get to just come in after you guys solved all the problems. So I love it. And now afterwards, Lena receives consistent coordinated prenatal care in Hooper Bay. Village Clinic can provide routine prenatal care. We've talked about this like warm handoff, locally based community health aides, community health practitioners supported by maternal health patient navigators. Again, that coordination component, nutrition support, behavioral health check-ins, and birth planning, and having that remote access. And when she travels to Bethel as needed for delivery, it's planned, it's shortened overall. And after returning home, she receives postpartum visits. I saw a lot of comments by Dr. Ireland in the chat about it's not just at delivery, but also afterwards, and making sure that health is supported, both from a physical as well as mental health. And our integrated teams make up of clinical and non-clinical community health workers to strengthen that family stability, improving outcomes for mom and baby as a whole. So thanks for solving all the problems for us and getting to this after vignette with Lena. Next slide, please. So we wanted to then have a little bit more of a facilitated discussion about what would be needed to make that happen. So you guys have shared a lot about how we could get to that place. Again, we have separate conversations for sparking technology and for workforce. But again, this needs to be sustainable. There's the opportunity to apply for like 5 years worth of funding and then afterwards being able to move forward. So what partnerships are needed? What all do you need from us? What initiatives or projects would help to facilitate this to making it happen? So opening it back up to conversation with you all.
And I think we have, Tamara has your hand raised again. So I think you wanted to add some additional insights. So go ahead and come off mute.
Yes, thank you. I was asked to briefly talk about our program, Help Me Grow Alaska, and I think it's relevant to some of the comments that were made here in the chat and in the conversation. So Help Me Grow Alaska is a resource and referral navigation system. So we maintain a comprehensive resource database of resources for families with children prenatal to 26, but not limited to just those resources. For anything from medical, behavioral health needs to basic needs, social determinants of health, really anything that a family needs at one point in time to support raising their child to their full potential. And we serve statewide, and we have family support specialists that provide this service to families or to providers if the providers are the ones needing the resource. But one of the other parts about, so number one, I think like all the comments were very relevant and correct on how do we support that wraparound within the community? How do we support communities to understand what resources and services are available in the community? And it can look very different in how different communities are approaching that, and what, how they're building in those supports from within when maybe state programs don't exist, or there aren't providers in the community. How are communities meeting family needs, or how would they like to be meeting needs? And that's some of the nuance of families' experiences accessing services and care that we track through our work with families at Help Me Grow Alaska. So when we talk to families, they could be connecting to us for anything from a need for speech therapy or behavioral health or food insecurity, whatever that referral came through. But there's often, right, a lot of co-occurring needs, and we track the information on the gaps and the barriers that families are in families' attempts to access services, and that can kind of inform both on a community level and state level where those gaps are or where the strengths that exist are. So just kind of putting that out there as something that does exist and is working a lot with families who are in Lena's situation.
Yeah, no, I think that's great. And I'd like to dovetail on that with Carrie Van Dusen, if you don't mind coming off chat. Kind of we touched on schools, but I think there's a lot of opportunity in schools. So Carrie, if you're wanting to share with the group at all your thoughts, go ahead and do the hand raise. And there you are. Yeah, let's hear your thoughts on this.
Hi, all. Thank you so much for having this forum so that we can all share and hopefully find folks to collaborate with on this important work. What I was simply saying was that a great place to initiate that community engagement is through schools. When you educate children, they bring what they learn home to their families and their parents, their siblings, and that permeates throughout the entire community.
Yeah, no, and I appreciate that. I think educating the family is what happens in schools, and I get educated daily from my student. I'd like to turn it back to Anne, who's been looking at the chat and kind of synthesizing, and I always appreciate her kind of big vision on this. So back to you, Anne.
Yeah, no, seeing so many great comments in the chat and chat box. We are working on ways to continue this collaboration outside of this call. So there's been comments on that, on this, and then other ones as well. So stay tuned. And for those of you who this is the third one, you're starting to get to know each other at this point. I would also emphasize that we've got not only some great members of the Department of Health team, so you see like Leah Van Kirk, who like spends a ton of time thinking about policy and knows and loves this area so well, providing some really great input. But like tomorrow, like there are some great partnerships within the state who know the state really well. So if you're really don't know Alaska, but you have some really great ideas, look in the chat box. There's some great ones there. I also just wanted to highlight a comment that had come up about uninsured or underinsured and how do you coordinate across silos. You will see in the Department of Health's application that they called out the Fresh Start program specifically. And that's available to every Alaskan, regardless of their insurance type, to deal with hypertension, diabetes. So what would that look like for maternal and child health? That it would be, things that could be accessible regardless of insurance type that would then be able to dovetail into more expensive care like delivery, et cetera, that would happen when you are in that might be covered by insurance when you're in a more urban center. So I guess I would just really challenge us. I think it's very typical for us to think about. I get very worked up about population health versus public health. Public health is population health, but we're not just thinking about the population of the insured or just the population of the Medicaid population. We are thinking about Alaskans. How can we broadly think about Alaskans regardless of their type of service, and how do we braid those key services underneath? So I just would encourage us as we think big and impact to think about Alaskans first, insurance and insurer types second, but not as the first component so that we're able to braid across sectors. Back to you, Lisa.
Great. I think the other aspect to this that I'm seeing in the chat is how do we take that child who we've created services for and help them continue throughout life? So as they transition out of the community, what does that look like? So that's another aspect that I want us to keep thinking about as we're designing these systems. How do we grow with the child? How do we continue that good work that we put in the ground with these kids? I also wanted to see if Rebecca Porter was available. I know she had some insight to share. So Rebecca, if you're on and can raise your hand, we can let you share your comments. There you are.
Thanks for giving me space and time for this important conversation. My name is Rebecca Porter. I'm a nurse consultant with the Section of Women's, Children's, and Family Health, and I'm also the coordinator for the Alaska Perinatal Quality Collaborative. Some of the thoughts that we had specifically from like the lens of the AKPQC was increasing access to OB simulation training for rural providers, even those that don't have labor and delivery services at their facility, because it's important to make sure that everyone's able to take care of immediate needs of pregnant people. So that was one of the things that we were thinking about expanding, access to those trainings, and also seeing if we could use like health aides in that for that as well, incorporating health aides into those simulation trainings as well. One thing that I did also want to mention, and I'll put it in the chat, is that the Alaska Hospital and Healthcare Association did do a quite robust report on the Alaska maternal health landscape. And so I would encourage folks to take a look at that because it is just a wealth of knowledge. They did a really great strength-based approach view of what our current landscape of maternal care is in Alaska.
Thank you for sharing that. That's a great resource and yeah, definitely very deep with information for Alaska. So that's exciting. I think we're getting to the point where we're starting to kind of wrap this up. I'm going to turn this back to Dr. Zink as we kind of assimilate what we've heard today and kind of our next steps. So back to you, Anne.
Yeah, no, so appreciate it. And thanks for, again, all the comments that are happening in the chat box. Go ahead and move to the next slide. There are lots of different ways that we can think about supporting Lena. And we've heard about from before birth all the way through. We're seeing comments in the chat box about talking about head injuries and what affects children and what are the causes of mortality for our youth within the state. So as Rebecca mentioned, I'd really encourage you to look at the reports that have come out already, where those strengths-based things are and how we can lean into the work that's already been done, leverage and jumpstart off of that. We've talked a lot about telehealth remote monitoring, what ways that can be used and deployed. So if we're at fish camp or we're out, working in Valdez for the summer or we're in Sitka, we've got access to the resources that we need to be able to care for ourselves and our loved ones. And so it's not about the place, but it's about the person. Integrating maternal and behavioral health, encourage people to reach out to the Women and Children section. The Maternal Health Mortality Review Board always has some really humbling insights into some of the causes of death and challenges that women are seeing across the state, and taking a look at that, as well as thinking about other behavioral health challenges. How do we integrate that? How do we make that simpler for patients? We've talked a lot about in this call maternal and infant home visiting programs, and there's great work done there already within the state. There's more work that always needs to be done. I see people calling out the NEST program in Louisiana. There's lots of examples. I do think thinking about how we can learn from our national partners and how this is kind of sustained in a payment model can be helpful for us to take an idea that may be grant funded within Alaska and turning it into a sustained program that really reduces costs and improves outcomes as a whole. So I think that there's some great examples from across the country. The community-based maternal health workforce expansion. I love the comment about, as an ER doc, I'm terrified if I ever have to deliver a baby, and I'm always up for upskilling on that one and making sure that I've got the team there to help me, and having refreshers, because it's not something we do on a super regular basis. Fortunately, I work at a hospital that has OB within 15 minutes call, but sometimes that 15 minutes isn't enough. So always looking forward to making sure that we've got the skills, again, regardless of where people are at. Care coordination and birth planning support. We've talked a lot about silos, and I appreciate kind of the comments about insurance and silos and how we work through that. And again, excited to work with you all on, again, how do we make systems work for patients instead of asking patients to work for systems, which I think so often happens in this space. And then this consumer facing maternal health, I oftentimes say no one cares more about their health than that person. So how do we empower that person and that family to be advocates for their own health and really thinking about patients first and building from that. Next slide. So I guess I will just say that, I wish I could have come from the very beginning, but I take away from this just a lot in that maternal home visiting, the wealth of resources that are already within the state to build on. I do think Alaska, particularly when it comes to healthy beginnings, is a really amazing place to practice and work, and very, very unique. And so thinking about home births and doulas and midwives and community health aides and birthing homes is very different than many other places that my colleagues work. But I just wanted to thank you all for your thoughts and input, and I'll turn it back over to Lisa.
And next slide. Perfect. So we are going to do a poll so we can kind of inform our next session. So we did a poll earlier, kind of prioritizing, but this is really the #1 challenge you want us to tackle, and we're going to use this for our next session. So if everyone could kind of respond in the chat while we're doing that. And while that's happening, I'm wondering if Leah Van Kirk could raise her hand and come off mute and just share a little bit. She just brought in kind of that isolation and some of the mental health challenges in rural Alaska. So I just wanted you to share while people were populating this in the chat. So go ahead, Leah.
Hi, good afternoon. Thank you. What I want to share is just that oftentimes in rural Alaska, and even in all communities across our state, that we are impacted by isolation and loneliness, and we see that through our data. And, I think supporting that is really important. And when we think about how we support loneliness, that's about building connectedness. And there's actually a lot of research around the impacts of connectedness and long-term health. And so, I may have needed to add my comments to the healthy community session, but I really want to call that out, especially for new parents, because when you bring a baby into the world, not only is there, the stress of caring for your child and making sure their health needs are met, but parents need a lot of support. And so I just wanted to emphasize the importance of building supports and building relationships with people within a community to develop those natural supports so that you can engage your natural supports.
Perfect. And to that end, if we could go to the next slide, we do not want anyone to feel socially isolated. And so we have some more sessions coming up next week. So let's continue this dialogue around technology, healthcare access, and pay for value. And as I mentioned before, a lot of these are interconnected. So let's really work on continuing this dialogue. I feel like a lot of great work happened this week. A lot of connections are already being made. And I'm pretty excited about this. This is fun stuff. So again, thanks for engaging. And I'm going to turn this back over to Commissioner Hedberg and just want to thank all of you for joining us.
Thank you so much, Dr. Rabinowitz and Dr. Zink. Next slide. So really good conversation. As a reminder, this is the first impact session for Healthy Beginnings. We are level setting with just what is the focus, what's the purpose of this initiative. In the future impact sessions on Healthy Beginnings, we're going to do a deep dive into each one of these different topic areas, and we're really excited to do that with you. It's been great to see all of the comments in the chat. I saw childcare providers that are we included? Yes, you are. And you play a really important role in supporting our infants and toddlers so that they are ready to engage in school at that kindergarten preschool level. So all of you, we are going to work with you as we build out Healthy Beginnings, expand what really is working and address the gaps that don't exist in Alaska. There's a QR code, so please scan that. You can learn more about the Alaska Rural Health Transformation Program. Next slide. And to cue you in, if you have questions, please don't send it to one individual. If it's RHTP related, send it to the general inbox. It is staffed and they are responding to those questions. We also are very happy with the overwhelming response to the RHTP program in Alaska. And our mechanism to communicate with all of you is with our website. And so we continue to update our website. So if there's no updates, we're not ready to share the next steps yet. But if you want to know when the website is updated, you can go to our website and click on the icon that says sign up for updates, and we'll send you an email with the new information so you can stay abreast of the new information that is being posted. Thank you so much again for participating, and we'll see you on the next series. Take care, guys. Bye.